A mouth ulcer, also known as an oral ulcer or canker sore, is a small, painful lesion that forms in the soft tissues of the mouth, including the inside of the cheeks, lips, tongue, or gums. Mouth ulcers are usually round or oval with a white, yellow, or gray center and a red, inflamed border. While most mouth ulcers are benign and heal on their own within 1 to 2 weeks, they can be uncomfortable and make eating, drinking, and talking difficult. Types of mouth ulcers. There are several types of mouth ulcers, depending on their cause and characteristics. Minor ulcers, the most common type. These are small, less than 1 centimeter in diameter, and heal on their own within 1 to 2 weeks without leaving scars. Major ulcers, larger and deeper than minor ulcers. Major ulcers can exceed 1 centimeter in diameter and may take several weeks to heal. They may leave scars. Herpetiform ulcers. These are clusters of numerous small, pinhead-sized ulcers up to 100 that can merge together to form larger sores. Despite the name, they are not caused by the herpes virus. Causes of mouth ulcers. Mouth ulcers can have a variety of causes, ranging from minor injuries to underlying medical conditions. Common causes include injury or trauma, biting the inside of the cheek or tongue accidentally, brushing teeth too hard or using a toothbrush with hard bristles, wearing poorly fitting dentures or braces, irritation from hot food or drinks, sharp edges of teeth or dental work. Stress and hormonal changes. Emotional stress and hormonal changes, e.g., menstruation, are common triggers for mouth ulcers. Nutritional deficiencies. Deficiencies in certain nutrients, particularly vitamin B12, iron, and folate, can lead to mouth ulcers. Food sensitivities or allergies. Certain foods can trigger ulcers, including acidic or spicy foods, e.g., citrus fruits, tomatoes, chocolate, and coffee. Infections. Viral infections, such as herpes simplex virus causing cold sores or hand, foot, and mouth disease. Bacterial infections, such as those from Helicobacter pylori, the bacteria linked to stomach ulcers. Underlying health conditions. Canker sores. Aphthous ulcers. These are recurrent ulcers with no clear cause but may be linked to the immune system. Crohn's disease or ulcerative colitis. Inflammatory bowel diseases that may cause mouth ulcers. Celiac disease, the gluten intolerance that can cause mouth ulcers. Behçet's disease, the rare disorder causing blood vessel inflammation that can result in recurrent mouth ulcers. Lupus, an autoimmune disease that can affect the mouth. Medications. Certain medications, such as NSAIDs, non-steroidal anti-inflammatory drugs, beta blockers, or chemotherapy drugs, can cause ulcers as a side effect. Smoking cessation. Some people develop mouth ulcers after quitting smoking, though this is typically temporary. Symptoms. The primary symptom of a mouth ulcer is pain, which may be mild to severe depending on the size and location of the ulcer. Other symptoms may include the sore or lesion in the mouth that is round or oval-shaped, usually white or yellow in the center with a red border. Swelling or inflammation around the ulcer. Discomfort while eating, drinking, or talking. In rare cases, a fever or swollen lymph nodes, particularly with larger or more severe ulcers. Treatment and management. Most mouth ulcers will heal on their own without treatment. However, several methods can help reduce pain and speed healing. Over-the-counter treatments. Mouth gels or ointments. Products like benzocaine or lidocaine can numb the ulcer and reduce pain. Antiseptic mouthwash. Rinsing with chlorhexidine or salt water can help prevent infection and promote healing. Hydrogen peroxide-based rinses, used to clean the ulcer and aid healing. Topical corticosteroids. Prescription creams or gels containing steroids may be used for more severe or recurrent ulcers to reduce inflammation. Pain relief. Paracetamol, acetaminophen, or ibuprofen may be taken to relieve pain and discomfort. Avoid spicy, acidic, or rough textured foods that can irritate the ulcer. Nutritional supplements. If mouth ulcers are linked to a deficiency in vitamin B12, iron, or folate, taking supplements may help prevent future ulcers. Good oral hygiene. Maintaining oral hygiene by brushing gently with a soft bristled toothbrush and using a mild, alcohol-free mouthwash can help prevent further irritation or infection. Hydration and soothing remedies. Ice chips. Allowing ice to melt in the mouth may soothe painful ulcers. Honey or coconut oil. Some natural remedies, such as honey, have antimicrobial properties and may help reduce pain and inflammation. Prevention. To help prevent mouth ulcers or reduce the frequency of occurrences, consider the following tips. Avoid trauma to the mouth. Use a soft bristled toothbrush, and be mindful of accidental bites while chewing. Reduce stress. Managing stress through relaxation techniques or regular exercise may help prevent stress-induced ulcers. Maintain a balanced diet, ensuring adequate intake of vitamins and minerals, especially vitamin B12, iron, and folate, can reduce the risk of ulcers. Avoid irritants. Limit or avoid spicy, acidic, or rough textured foods that may trigger ulcers. Quit smoking. Smoking cessation, although it may initially cause ulcers, reduces the risk of recurrent ulcers over time. When to see a doctor. Most mouth ulcers heal on their own within 1 to 2 weeks. However, you should consult a doctor or dentist if the ulcer persists for more than 3 weeks. You experience frequent, recurrent ulcers. The ulcer is unusually large or painful. There are additional symptoms such as fever, diarrhea, or rash, which could indicate an underlying condition. Difficulty swallowing, speaking, or eating persists due to the ulcer. Conclusion. While most mouth ulcers are harmless and resolve on their own, recurrent or severe ulcers may indicate an underlying health issue that requires medical attention. Managing stress, maintaining good oral hygiene, and avoiding irritants can help reduce the risk of ulcers and improve overall oral health. Would you like more details on any specific treatments or home remedies for mouth ulcers?